Welcome to Get Unstuck, Move Forward with Your Life. I am your host, Jason Hopcus. Thank you for joining us today. Today, I am grateful to have my friend and colleague, Steven Haden, joining us. Steven is the CEO and co-founder of Envision U, a Colorado-based nonprofit behavioral health initiative that addresses the disproportionate burden, disparity in care, and poor outcomes that LGBTQ plus individuals encounter every day. Additionally, he is the founder and CEO of U Flourish, a first-of-its-kind wellness app for the LGBTQ plus community, launching in the United States in the fall of 2023. Steven is also a mental health clinician with Queer Asterisk, a nonprofit providing comprehensive behavioral health services in communities throughout Colorado's urban corridor. Steven, thank you for joining me today for another episode of Get Unstuck Radio. I'm so grateful to have you here today to talk about a community that does not seem to get enough positive attention.
Jason, it is such a pleasure to be part of this conversation today. Good to see you, and looking forward to a really fascinating conversation.
Thank you. So the reason I wanted to have this conversation is obviously being a part of the LGBTQ plus community myself. I recognize that, day in and day out, I see so many things in the media and the news that just don't play out in a positive way for our community. And believe that it is, through conversations like this with people like you who are serving that community on a daily basis, we have an opportunity to evolve the narrative and put some positivity in the world. Like, give me a little backstory. I mean, I want to get into all the fabulous things you're doing. Give me a little backstory around how you've evolved into the work that you're doing today.
Yeah, Jason, similar to you, my personal lived experience and story is foundational to the work that I do today. I grew up in the Midwest, came out as a gay man in the early 90s in the midst of the AIDS crisis. It was a moment in time where there was a close correlation. The perception was that by being gay, that would ultimately lead to an HIV infection. So it was a very scary time, a lot of misinformation. And so that's kind of where I started my journey. I come from a family that has a history of some mental health issues. And in the early 2000s, I was struggling myself with the pressures of work as a management consultant in New York. I just finished up my MBA program and trying to navigate a world that isn't necessarily built for members of the LGBTQ plus community and experiencing sort of more societal pressure to engage in substance use. I developed my own substance use challenge and really debilitating depression. And in a search to get help, I became hopeless and ultimately decided that a better day wasn't ahead for me. And so I attempted suicide. And, thankfully I'm here today. And it was, at that time of my life that I was fortunate to survive. And thankfully today I'm thriving, that I started a process of thinking about what's next for me. What can I do with my story and experience that could help other folks navigate a challenging environment? So in 2012, I started doing some work for a nonprofit that was helping incarcerated women reimagine their possibilities to live a life once they left prison. And it was through that work that I just felt so compelled that it gave me the courage to think about going back to grad school, which I did. I got a master's in social work degree. I moved to Denver and started working for a community mental health center, primarily with people that had been previously unhoused, previously incarcerated, and were experiencing pretty significant and complicated mental health issues. I made the decision as a member of the LGBTQ plus community, as a person with lived experience, to start the nonprofit Envision U. And it really brings together all the various aspects of both my professional and personal experience to help further my commitment, our commitment as an organization to support the mental health and well-being of LGBTQ folks.
I love that. And again, I'm grateful that you shared kind of the personal story that brings you to doing this work, which is the same for me and the work that I do. And I often find that the people who are the most inspired leaders, who are the waymakers, or the conversation havers that need to be had, it is from personal struggle and experience. And you and I met somewhere along the way when you were at the Community Mental Health Center, just as Envision U was getting its foundation. And I love what you've been able to create since then. What I really would love to hear from you, since you have your finger on the pulse of this community, I know when we talk about mental health statistics and how overwhelming and staggering they are in just affecting us as society at large, when we start talking about the LGBTQ plus community, they really erode even further. Kind of give us a state of the state around what are we seeing in today's world that makes this conversation so necessary and important?
Yeah, indeed, Jason. So, let's think about sort of the broader environment that we find ourselves in. This year alone, more than 500 anti-LGBTQ laws and policies have been put forward in state legislatures around the country. And while
Wow.
I feel very fortunate and privileged to live in a state like Colorado, the fact is lots of people are living in dangerous and hostile environments that are preventing them from living their most authentic self. We know that rates of mental health concerns are much higher in the LGBTQ community, in part because of those societal issues. Um, Stigma, discrimination, and marginalization all play a role. And sometimes folks say, well, is being part of the community, does that lead to some sort of mental health condition? The answer unequivocally is no. Historically, there was our community was pathologized. It was considered a disorder up until 1972 by the American Psychological Association. So, of course, we've made a lot of progress, and yet our community is still pushing up against community and systemic barriers that prevent us from living our best lives. It's also important to think about, LGBTQ folks are not a monolith, right? I'm a white, cisgender, gay man. I have a lot of privilege, and that's not true for people with various other identities. When you factor in race and ethnicity, you think about geolocation, you think about faith communities where people grew up in. What was that foundation for that young person growing up? What was the family dynamic? And this is really important for your audience to understand that the prevalence of adverse childhood experiences, which goes by ACEs, is significantly higher among LGBTQ folks. And these are those significant events that create trauma for a young person. And when those numbers go up, as they do for LGBTQ folks, at rates that are 2 to 4 times greater, you see an increase in mental health issues, substance use, and also comorbidity as it relates to healthcare and a person's overall health. And so you impact a person's quality of life, you impact the longevity of that person's life, and it just complicates that person's ability to navigate a challenging environment.
Well, that, and when you certainly couple with what's happening in the political landscape of new laws that are being proposed and created daily that really set back this community that fought so hard for some of the protections they have, it feels like we're fighting battles that have already been won again. And I know, even from my own perspective, there's something very defeatist about why is this so hard?
Indeed, and it does feel that way. It's hard to believe that we are where we find ourselves today, and yet, for political purposes, political leaders have chosen the LGBTQ community, particularly the transgender community, as a focus and target of pretty hateful rhetoric and policies that are going to impact a person's ability to seek the health care they need, or protections in employment and housing, and the things that are so crucial that many of us take for granted. And this is all happening too, Jason, in an environment where we have these higher rates of mental health concerns. And then when people do access the mental health care system, what we find is that many of our mental health professionals, while well-intentioned and good meaning, don't have the skills to work with LGBTQ folks to really understand why this community is marginalized in the way they are, the prevalence of trauma. So it prevents many folks, many of our mental health clinicians from delivering culturally responsive and affirming care, which ultimately means that person's not getting a high quality care that they need. And so we see people disengaging from care. We see less productive outcomes from that therapeutic process. We find people who are going in inpatient care, being forced into sort of housing restrictions that aren't helpful. And so ultimately, we have higher needs, less access to quality care, which is one of the reasons we see higher levels of acuity, including up to overdose and death by suicide within the LGBTQ plus community.
You know, what I'm really hearing in this conversation is there is also a lack of cultural competency, not only from society at large, but from the system, so to speak, that serves this community with their various needs. And frankly, you know, it feels like there is a gap and an opportunity to create systems that include better language around how do we do this. I know, you know, we've evolved into this world of pronouns, which even as, you know, a 48-year-old, you know, gay man, I'm still struggling to really adapt to all of the pronouns because they're so different and constantly changing. How does the person who may have a loved one that is part of this community, how do they show up to support them in a world that is changing with needs that are changing? How do we start normalizing some of these things to where people can be an ally for this community in a positive and supportive way?
That's a great question, and that really formed the part of the impetus for me wanting to start a nonprofit to help address these issues. So whether you are a family member, a caregiver, a teacher, coach, faith leader, or a mental health professional, I truly believe that most people are well-intentioned. But
Right.
without education and resources, we're likely to show up in a way that maybe isn't most helpful. And I always start with meeting people where they are. It's not my place to judge another person's lifestyle, choices, how they identify. So starting from just that foundational place is essential for creating a safe space for people to have tough conversations, right? And so for a parent or caregiver who has a young person who's navigating and questioning their gender identity or sexual orientation, what are we doing to create a brave space for that young person to feel comfortable going to that trusted adult in their life and saying to their mom or dad or faith leader or coach, hey, I'm really struggling with this. Like, you know, I'm showing up in a world and I feel different from a lot of my peers. And how can we lean in with intention to both listen, to have empathy, and to understand? And part of that understanding comes from doing our own work, challenging the biases that we have, to challenge, you know, you mentioned sort of your own experience and growing up a world where maybe people didn't introduce themselves with pronouns, or that having sort of more open conversations about these things were not as common. So, you know, challenging whatever biases we have, learning more about the communities that may be different than us, and then just being present and listening. And this is true not only for us in creating a welcoming and caring community in which, you know, I think most of us want to live in, Um, it's also about creating spaces for people to talk about their mental health. And if one of the takeaways and positive impacts of the COVID pandemic has been a willingness for people to be more open about their own mental health struggles in a way that even a few years ago, I think most people were uncomfortable with. And when we talk about our mental health, Jason, as you know, not only does it break down stigma, it creates a sense of belonging and connection and reminds us, we're not alone. Many years ago, as I was struggling, um, I didn't really have the capacity to look around and say, oh gosh, I'm not the only one. But at the time, that's how it felt, which is what led me to think about suicide as the only viable option. So, I'm excited that there is an increasing awareness about the prevalence of mental health issues across the board for all of us, right? I mean, physical health and mental health are a part of who we are. And some days we might have good mental health or poor, great physical health or not. And we need to be in relation with folks and living in communities where it's encouraged and supported to have these conversations.
And even if you don't agree or understand, it doesn't mean that you get the opportunity or you should have the opportunity to marginalize somebody else's experience. Like, I think this courage to show up and be vulnerable, who you are as you are, I think that is an act of courage that is so often dismissed or overlooked when we talk about these conversations. And frankly, I think the people who are shining the light on their suchness, let's call it, the things that make them uniquely them, I think those are really the heroes of the conversation. You had mentioned to me that suicide is the leading cause of death among LGBTQ plus youth. Give me some additional context to that shocking statistic.
Yeah, thanks, Jason. And it is heartbreaking. It's one of the things that really fuels my passion for this work is understanding that when you feel alone, there isn't a sense of belonging, or that the people in your life are not champions for who you are, your true authentic self. Um, it's not surprising that those thoughts don't start to dominate your thinking about your future. We've talked a lot about so far today about, kind of the systems that are in place where we see discrimination, harassment, and bullying of members of our community. And that just furthers that sense of isolation and a sense of being despondent. And, I keep coming back, Jason, and you touched on this earlier, is, there's certainly a place in society where many people look at the world through a scarcity mindset. And somehow that if I give if I create space for other people, that somehow that's going to take something away from me. And I think that is just absolutely faulty reasoning. If what I want, deeply passionate, I want everyone to thrive. Why is it that I wouldn't want the family living next to me to have all the same possibilities and privileges that I do? Absolutely committed to that. I want the young people in their life, their children, to go to schools that are high performing and supportive, with well-paid teachers and resources. I don't have kids, but do I want to support that so those young people have all the opportunities that they need and deserve? Absolutely. And so I hope in part by our work, courageous conversations like we're having today, Jason, that we continue to open folks' minds to this idea that we want everyone to have the best possible access to resources and support so they can thrive as well.
I wholeheartedly agree with you 110% on that. One of the things that you mentioned earlier is coming from the place of privilege that you have being white, cisgendered male, same for myself, and during the break talking about our shared experience of what coming out may have been like for us individually, and how there are differences in the world when you start adding other layers to the conversation that create systemic challenges for people navigating the world. Like, let's talk for a second about, some of the barriers that you see in the work that you're doing that make this conversation more challenging, that if you don't have, a place of privilege to land, that can really be a detriment to those living their lives in a healthy, productive way.
Yeah, and I think it starts with, as we're talking today, is just that recognition of the privilege we have. If I don't have an appreciation for the ease in which I get to navigate this world, I think it complicates my ability to have empathy and understanding for the challenges that other folks have. I'm reminded that, if you possess identities, multiple identities that are marginalized and disadvantaged in society, it just compounds the challenges that you have in accessing the resources that you need to navigate the world, to build a life for yourself. I lived in New York City for many years, and throughout that time, I was never stopped and frisked. I was never harassed by the New York Police Department in any way. And so I'm grateful for that. And yet I would pass people who were, and certainly there's been a lot written about that policy by the New York Police Department. And we understand the people that was targeted in that effort. And certainly ill-advised and unfortunate and discriminatory practice. And so to not understand how that would interfere with a person's ability just to get through their day and do the things they need, I think would be unfortunate on my part. So again, it's increasing my understanding of how other people navigate the world, and then being committed as a social justice advocate for our community to thinking about innovative and impactful solutions that are going to allow people to show up as their best self and have access to what they need so they too can have everything they need to thrive in their own life.
And I agree with that. And I also want to say, when we bring the word privilege into the space, and I think it's kind of a loaded word, it is also a privilege for those people in the world who are not affected by some of these labels that many of us are walking around with. And to show up and assume that you understand the unique position or perspective that somebody else is navigating the world, I think is fairly tone deaf. And for anybody that's listening, if we want to advance the conversation, I think we should all, shine a light back on ourselves and recognize that many of us have an inherent privilege that may shield us from some of these painful experiences, painful events that happen in lives for, people that are trying to go on and live their lives and have the healthiest version of their life play out on a day-to-day fashion. Like that, it is shocking to me that how I choose to live my life or anybody else does plays out in such a damning way in the news and in the media, that we are all humans having a human experience. And I don't know why we can't get back to this place of recognizing that the unique fabric that makes us a community as a whole is made up of so many different unique threads. And, as humans, that to me is the richness of the experience we're here to have.
Indeed, let's celebrate our differences. Let's lean in and learn from folks who don't share our identities. And sure, it's true. When you look at the larger population in the U.S., the adult population, about 20% live with a diagnosed mental health issue. So what we know then is the vast majority of folks don't have that personal lived experience. But the reality is most of us know somebody. So even though we might not be personally impacted, there's a high degree of likelihood that somebody close to us in our own family or workplace or friend group is in fact living with a mental health disorder. So, it makes sense that we should better understand that and have an appreciation for just that added a layer of complexity that that person is living with, right? I don't have to share the identity of a person to have the empathy uh, for them and in their circumstances. And
Or to acknowledge the shared experience of humanity.
right. And, we saw this, and unfortunately during COVID, where there was just this sense of like a high degree of selfishness. Like, this is what I'm going to do for myself, and it doesn't matter the impact of my choices on other people. And how unfortunate is that? Can we not put aside, and again, it's not about political differences. We can disagree that policy A makes sense, or I'm in opposition to that policy. But fundamentally, Jason, I care about you as a human. I care about my neighbors, regardless of their identity, their political identity, where they choose to worship. None of that matters to me in the sense of forming community. I love learning about that. That's an important part of other people's identities. So, of course, I'm curious and care about that identity. But at the end of the day, I care about that person because of our shared humanity.
I love that. And you're so spot on. I mean, it's what the world needs more of. I'm just wondering, as you being the guy that's shining this bright light in the work that you do, for the person that's listening that maybe doesn't know how to open the door to have more inspired, empathetic, compassionate conversations with the people in their lives, where do you start? Where do you begin?
Sure. And I think it begins with the individual, right? So I know that if my cup is half full, it's very difficult for me to lean in and be a supportive and caring person in another person's journey. And so, what am I doing to take care of myself? How am I prioritizing wellness and centering that in my own life? How am I in my workplace fostering a culture of well-being? I mean, if you're in management and you're looking at the people that work for you as a leader, what are you doing to prioritize your staff, your team, their ability to live their best life? And so if I now am prioritizing that for myself, I then have the ability, I have the capacity and the resilience to be able to lean in and just say to somebody who's struggling, I'm here to listen. I'm not here to provide you with advice on how to live your life, but I am here to listen. And just as importantly, I'm willing to help walk with you in your journey at your pace, seeking the solutions that you think are best for you, because I care about you. So I start with the individual. Think about what you're doing in your life so that you can be living your own best life. And then how do we find ways to support the people that are in our lives so they too can live their best life?
That's beautiful. And really, if you think about it in a broader context, it's an experiment in kindness. And the fact of the matter is, and I go back to, you don't have to agree with somebody that is with what they are doing in their life necessarily to show up and listen to them, to show up and be kind to them, to show up and hear them, to show up and see them. It is possible to disagree and still hold space for somebody just in their human experience. I often say that I believe people do the best they can, and sometimes our best is not good enough. And there is an element of discernment of if your best was good enough today or not, and you have the choice to do better moving forward. But I believe that most of us have good intentions for showing up to support people in our lives and to navigate this world. Like, I want to believe that. I don't know that we always see that playing out and how the media portrays it, but there is this human experience of just be kind.
Yeah, it's so fundamental. And I'm reminded in my clinical practice, I was working with somebody who was homophobic and frankly quite hostile to the LGBTQ community. And as a therapist, I'm there to serve all people. I'm there to support each of the people that I'm doing work for. And rather than sort of immediately being offended or feeling like this was going to be a hostile relationship, I took the time to understand where that came from. And, I began to understand that person's childhood, the environment they grew up in, the narrative that they heard played out. And so, while of course I didn't disagree, and I don't, wouldn't want them to have that worldview, it was important for me to understand how they got there. And so, with that understanding, I could then begin to work with that person in my clinical practice or with the neighbor across the street who I'm sharing coffee with, to then start to think about how can we foster some mutual understanding? How can I start to break down that person's biases that they might have, in this case about my own identity, in a way that no longer feels threatening, confusing, to that person, to create that shared humanity, as you talk about so well, Jason.
I just think you really took that as an opportunity to build a bridge. And I wonder if where part of the conversations that we see playing out in the world fail is this space of not taking the time to realize that people aren't created in a day. Who they become, the values they have, the beliefs they have, they don't happen just in an instant. We are all, richly complex and woven with details of a long history. I wonder if there is a necessity for us to really, if we have a desire to dig in and really figure out where are some shared experiences that we can learn about each other from. I find if you're only looking at the conversations from how are we different and never from how are we similar, it's probably hard to find an inspired conversation, to birth that from those conversations. And frankly, it's an opportunity for any of us to do better.
Indeed, what a great perspective, Jason. And that's where that scarcity mindset lives, right? Those limitations that we place on ourselves, where we're focused just on differences and how we are in opposition to the folks in our life and in our community. And when we can step back and start from, what are our shared experiences? What are some of our shared identities? What are some of our shared aspirations? When you ask most people what they aspire to in life, that list is pretty common, regardless of gender identity, sexual orientation, faith practice, geolocation, political persuasion. And so if we're all aspiring to achieve certain things in our life, what a great place to start. And we start then moving from that scarcity mindset, which always interrupts a sentence with but, and we change it to and, right? Like two things can coexist. And again, we might disagree, and I'm still committed to listening and learning and finding some commonality between you and I. And that's where the magic happens.
I would love to get into really learning more about how you've taken the experience and the education that you have and turned it into this passion and purpose with Envision You and You Flourish. Give our audience a little more context around the work that you're doing to support this community.
Yeah, of course. I'd love to. So a little bit about my personal background in terms of what got me into this work. And I will say I am so grateful that I get to wake up every day and do work that I'm passionate about and that I believe is making a difference for our community, not just the LGBTQ community, but the larger community. And so when I started Envision U, the first thing that I knew was important to sit down and listen to our community. So I met with more than 300 people to help inform how I was going to go about starting a nonprofit that could address the mental health needs of LGBTQ folks. And what we heard still serves as sort of the foundation and focus of our work. We have a lot of programming to raise awareness about these issues. As more people understand the challenges of mental health issues for LGBTQ folks, it hopefully leads to not only greater sort of capacity for meeting those needs, but just creating those spaces for people who can talk about what's going on in their life. We're actively involved in advocacy efforts, both at the state and federal level, to ensure that the policies and laws that are addressing the mental health concerns of our community include the perspectives of the LGBTQ plus community. We have a great program called Q is for Questioning, and that's equipped to give teachers, parents, caregivers the tools and the education they need to create those affirming spaces for young folks navigating their own gender identity or sexual orientation. What we know, Jason, is one trusting, affirming adult in a young person's life from the Trevor Project reduces the likelihood of suicide by 40%, just staggering. So hopefully that's a call to action to folks to say, you know what, I need to show up in a way that is going to create that safe space so we can start to address the youth suicide crisis that we find ourselves in the US. Another program that's been really important to us is our comprehensive behavioral health provider training program. And this has given more than 1,500 mental health professionals around the US the skills they need to deliver that culturally responsive, high quality care to LGBTQ folks. And so when you think about levels of engagement, that therapeutic alliance, producing better outcomes as part of that therapeutic experience, we're seeing people being able to address those issues in a safe and caring environment. So that's really crucial. Another thing that we're working on, Jason, that really came out of our research early on with the pandemic was this growing sense of isolation and disconnection from other people in the LGBTQ community, especially in a digital space. And so at Envision U, we were inspired to start thinking about a digital tool that could help bridge connections, make it easier for people to find the help that they need, and to access wellness content and resources to improve their overall well-being. And so the idea for a new smartphone app, a wellness app that's going to launch later this year called You Flourish is an incredible project that I'm so glad to be a part of. And, by giving people the ability to find help, to find support, wellness content, and to connect with other people who share their lived experience is really powerful. And I'll share a quick story. I had an opportunity to meet with a Black trans woman in Alabama in a small community. She didn't know other people that had her identity. She was living with depression. And she told me the ability to connect in a digital space with other people who share my identity is going to be incredibly powerful for her to, again, navigate a really challenging environment. So we're excited to be building a product that's going to help her and millions of other LGBTQ folks get the help and the support they need to start to thrive in a way that many in our community are not currently doing so.
I just love that, and it's so necessary. And you picked up and are championing that beautiful word connection, that really is kind of the birthplace of everything and what anybody is seeking. I mean, you look at social media, the apps that we use day in and day out. I mean, they are all in their own way seeking to inspire connection within us. But the fact that you have chosen to pioneer, serving this audience in a way that connects them. So, the woman you just told us about in Alabama, she has a way to connect with other people that are like her. It goes back to the fundamentals of what we talked about earlier of helping people recognize they are not alone. And I find what is so often in our, and I'm using the word suchness instead of differences, but what happens for so many of us in our suchness is that we go down a path and believe that nobody understands, nobody will ever understand, there's nobody like us. And I just want to dispel that truth. Like, while you are uniquely you, and in fact, there is nobody uniquely like you, there are people that have lived, shared experience that are looking for you and want to learn and be your friend and grow from and experience life with you. And I think it is phenomenal and beautiful that you have taken this on to birth something that fosters connection. Thank you.
And I really appreciate that, Jason. And yeah, fundamentally, as you say, it just comes down to belonging, right?
Right.
I want to belong and be in community with other people who not necessarily share all of my identities or lived experience, but are fundamentally connected to my well-being. And similarly, I want to be there for other people in my life and for my community so that we can foster connection and community care.
I love that. And, what an inspiration you are for doing the work that you're choosing to do. I know it's deeply personal, but, it is the birthplace of something that has the benefit to impact so many and really change lives. I always like to leave things on a hopeful note, and we're coming close to wrapping up. We have a few minutes left here, but let's talk about some of the success stories that you've seen in the work that you're doing. You shared one a minute ago. Like, what's the bigger picture, and how can we find hope in a conversation that often feels hopeless?
Yeah, when I think specifically about some of our programs, when I listen to a grandmother who completes our, goes through our Q is for Questioning program, which is designed to create those affirming spaces for young people, and have her leave that training with the skills to better understand her granddaughter, to ensure that she's using the language that is supportive and kind to her granddaughter, is thrilling to me, because we made a difference in that one person's life that's going to lead to what we believe fundamentally, not only based on research, but what we know anecdotally, for that young person then to be able to navigate their adolescence in a way that perhaps before this workshop, that might not have been possible.
Right.
Think about the mental health professional who completes our training program, who shared with me we were working with an indigenous nation and training many of their mental health professionals. And I had one of them tell me, for the first time, I'm able to see my two-spirit, my LGBTQ clients in a way that I wasn't before. And now I feel so much more alliance with an understanding about not only the complexities, but the richness of that person's life. And how beautiful is that for them to be able to show up not only informed, but inspired in a way to help that person in their own journey.
Well, I mean, and the reality is, it goes back to being seen. It's seeing people. And I think the more, the more things, nag at us that feel like differences that we don't want to address, I think that is the opportunity to kind of peel back the curtain, so to speak, and take a look at, is there an opportunity for me to learn something here? I think that adds to the richness of our own lives, to really be able to recognize that the differences among us are what really make life interesting. And, I love that you've created this safe space for people to get educated, whether it's a family member, caregiver, loved one, or a clinician that's serving this community. I frankly think the world needs a whole lot more of that. Is it possible that somebody that's listening, if they're interested in the programs that you offer, is it just in Colorado, or is it something that they can access from another place and learn from the valuable work you're providing?
Yeah, indeed, Jason, our mental health provider training program is something that we have available to mental health professionals across the U.S. And so we're very excited in a conversation recently with a big mental health provider agency out of Boston, and we're doing work with folks in many other places around the U.S. So that's just one example. Certainly, You Flourish will be launched nationally, and an opportunity for people to connect and find the care they need. And I just want to reflect on, you mentioned sort of looking behind the curtain, and I think about that curtain as, once we look behind, and sometimes that takes courage because of maybe how we were raised or the community in which we live. But when we look behind that curtain and see that shared humanity, how incredible is that, right? Like, let's begin to celebrate our differences. Let's lean in and understand how our lived experiences may be different, but ultimately how we can show up in our best possible way for the people in our life.
Yeah, I so agree. And I think it's really, it's doing that again adds to the the experience that you're going to have in your own life. I guess the thing that I want to leave people with before we sign off is, what if somebody's listening that has a loved one that's struggling and they don't know how to support them, or if there is somebody that is struggling with their own issues, whatever they may be, what's a next step that they can take to start to pull this thread through, to know that they're not alone and know that they're supported? Like, let's talk practically for a second.
Of course, the first thing is you're not alone. So there are other people who have been through this journey. Recovery is possible. You're able to live your best life, even if you have an underlying mental health issue. There are a lot of resources out there that are intended to help you navigate that journey. And if you are that person as a parent or an employer or a friend who recognizes that somebody is struggling, I recommend two things. First, get educated. Spend a little time in a trusted resource, better understanding how mental health issues impact a person's ability to get up in the morning and get through their day. The second thing that I would encourage is, and it requires braveness, is to lean in and say to that person, I'm here for you. Please tell me what's going on.
Right.
I can
Which
tell.
doesn't mean you have to fix anything, by the way.
Absolutely not. You're there solely with the intention of listening and letting that person know they're not alone and that you care for them, right? So, yeah, it's not about prescribing solutions. It's not necessarily about coming to some resolution about outcomes. It's just letting that person know there's someone in their life that's available to them to talk. And I hope, if nothing else from this conversation, that your audience understands how incredibly powerful that is and how life-changing that is for the person on the receiving end.
Well, and I want to underscore that beautiful gift of presence, of being present for somebody and affirming they are not alone, and that how can you help, asking that specific question and listening. That is something that transcends any difference, any suchness, any uniqueness, and it applies to anyone in our lives. It doesn't have to just apply to people that are struggling with mental health conditions or addictions or that are part of the LGBTQ plus community. It applies to anyone. And I go back to what we said earlier. This is a journey of shared humanity and embracing the uniqueness in all of us, and really just showing up and seeing people. And I believe wholeheartedly when you show up and do that, the people that show up for you, vice versa, the experiences will be so much more profound. They will be more deep. They will be more fulfilling, and more begets more good.
Without question.
So, Stephen, before we wrap up here, tell us how our listeners can get connected with you and the work that you're doing.
Yeah, Jason, I'm sure at the end you'll have the website to be able to learn more about Envision You, as well as You Flourish, the smartphone app designed to support the well-being of the LGBTQ community. We have a lot of resources available to you to start to better understand the sort of the conditions and that prevent many people in the LGBTQ community from living their best life, and resources available to folks to be able to get educated and supportive so they can further their own recovery process. You know, I've shared during this conversation, Jason, how deeply personal it is, this work to me, and it is for our entire team. And I'm so grateful I get to work with folks who care so deeply about changing the world for the better. And, you know, at the end of the day, how lucky am I that I get to do this work?
I love that. That is so beautiful. And for those of you that are listening today, thank you. If you haven't subscribed to our Get Unstuck radio show pages, you can find us at Get Unstuck Radio on Facebook, Instagram, LinkedIn, Twitter, and YouTube. Next week, we have another inspiring guest, my friend Karen Comba. Karen is the author and TV host who has recently written a book, The Snipers We Couldn't See. It's her personal story of growing up with a schizophrenic mother. She's dedicated her own life to advancing the care of those who struggle with mental health. You will not want to miss our inspired conversation. Stephen, I know you said this just a second ago, but just to really end on gratitude, what's one thing that you're grateful for today?
I'm grateful that I'm alive.
I love that, and I'm grateful for that too. Until next time, remember every journey begins with the next step, and you too can be your own champion. Thank you for joining us.